Thus, in response to soaring medical scheme costs, a call is being made for a collective focus on preventative healthcare and education, with several major medical schemes announcing double-digit increases for 2025. Profmed CEO Craig Comrie believes health literacy and preventative care is the only long-term solution to help knock down healthcare costs for all South Africans. He joins us for more. A very good evening to you, Craig. Thank you so much for your time. I suppose the big question on many South Africans' minds is, why is healthcare so expensive, and how does healthcare inflation then come into play?
Well, healthcare inflation has over the last 10 years always outstripped our abilities to earn income. So even our salary inflation is certainly not keeping up with the healthcare inflation phenomenon. And it's not just in medical schemes. I guess it's even in established national health systems throughout the world. We find that inflation of 8 or 10% drives effectively the cost of the claims and the services that need to be provided in a healthcare context. And so that's due to a few things. And one of the big things that we're noting is the fact that we have a bigger burden of disease, or the fact that we have chronic illnesses setting in a little bit earlier than normal. In fact, we have people living longer. So where the average age of people 20 years ago was probably in the 70s, we now see it move closer to the 80s. So people are living longer, accessing more health, and that means that the costs increase. Along with, fantastically, we have some health technology that comes through and helps us to live longer. But those all add to the costs that we're experiencing. So what we have to do is we have to get the healthcare consumer educated and encouraged, if not even incentivized, to take charge of their own health. And that prevents those long-term claims and ongoing healthcare costs, whether it's in a public sector system or a private sector system like medical schemes in this country. We really need to get people to engage in terms of their own health.
What has also been noted is that some schemes are able to set lower price increases while others are hitting double digits. How does that work?
Yes, sometimes that's only the formula of attracting younger people into the medical scheme market. So that drives an initial lower overall claims cost. And it is it's the insurance concept where the young tend to cross-subsidize the older that are on the medical scheme. And so if you don't have the inflow of those young members, you then just sit with older members who access more healthcare costs. So the way to also combat just a young member or an age-based claims experience is to actually encourage people to take charge of their own health, be educated. And we have the unique position in Profmed to look after healthcare professionals themselves. And so we find that because they know what they should be doing and how to access health in the right context, they are limiting the amount of claims that are being submitted. So education is a motivation already in terms of how you can manage your own health and longevity in a happier way in your own life. And so that helps. The other alternative, the other mechanism that medical schemes would be using is they are starting to incentivize preventative health checks. So your essential screening checks that go along with long-term diseases like diabetes, hypertension, and even cancer-related things. So if you go regularly for your preventative checks, we find that it limits the claims costs in the long term. But people tend to only do that when they already are sitting with the chronic condition. So we're encouraging people to more regularly take charge of their health, be aware of things like even mental health related conditions that you can get help earlier in terms of managing your health.
So with that said, how do you think digital tools are able to now speed up the transformation process?
So it's interesting. We've actually launched in 2025 a new digital tool within the Profmed context that can read your blood pressure and everything from the camera on your PC or a good enough smart device, a handheld smart device. And these are all FDA approved tools now in terms of measuring some of your key risks. Unfortunately, the medical scheme industry has been designed about curing people, not preventing people. And what this does, it helps to pick up the risks even earlier. And you don't have to go to a pharmacy or a doctor to have that risk measured. You can actually just have this thing look at your face. It reads blood vessels in your face and comes out with a very accurate reading in terms of blood pressure and other health concerns that might manifest in its assessment. And so these tools enable quite smartly easy access for people to understand their risk. And after you've gone through the assessment, it'll give you guidance in terms of how to manage the risk. And in the most dire situations, it will tell you, please make an appointment, or encourage you to make an appointment with a healthcare practitioner, doctor, who can actually assist you with what it's detected and help you through the journey. So the earlier you detect risk, or the easier it is to access these detection mechanisms and diagnostic tools, the better it is to save long-term costs of landing up in hospital with a big event.
And that's quite important, pardon me, because you made mention that more younger people are being diagnosed with chronic illnesses. What are some of the preventative measures, or perhaps the contributing factors that you've seen as you get the numbers in with more young people now falling ill?
Yes, so the idea is that for a long time, the medical schemes themselves have been structured around only taking care of you when you've had an event like the hospital event. Now, if you're young and tend to not want to go see the doctor, you can just measure some of your risks using the digital applications. And that already gives you, and it gives your medical scheme, an opportunity to intervene earlier and encourage you to actually make sure you're exercising, that you're looking after your health, that you're resting properly, and it even measures some of your stress levels as well. So it helps you to deal with the more mundane things that people aren't always aware of as things happen to them. And so for the first time, we've seen, even in the younger population, as they use those digital health assessment tools, they then have access to the ability to say, hold on a second, I have a risk that's emerging here. Let me change my behavior. And it's in the changing of your behavior that you then start to become more engaged and invested in your long-term health.
Yeah. How do you think a lack of health literacy and preventative care can impact the viability of the NHI?
Yeah, so healthcare across the world is a big expense. So the health inflation that you've seen manifest in a medical scheme context is the same inflation that drives the NHS in the UK, the Obamacare in the US. And so even in the public sector in South Africa, it's the same inflation rate that drives the costs. And so we've seen that the investment into healthcare, the growing investments needed into healthcare, aren't being matched by the revenue, the tax revenues, and the public purse in terms of funding that. And so it does pose quite a significant threat to even NHI. So many people in the NHI debate are talking about whether it costs 500 billion or up to 2 trillion rand a year to actually run an NHI in South Africa. Regardless of what that number is now, can you imagine if it runs at 10% a year and our growth rates sit at 1.1 or 2%? We just are never going to close the gap in being able to afford and finance an NHI. Whether it starts at 500 billion, it's up to 2 trillion in a very quick time with that type of health inflation driving it. And it's the same problem in all parts of the world in terms of trying to manage and bringing down the overall healthcare cost.
Very well. Thank you so much for speaking to us this evening. We leave it there for now, as we were speaking there to Profmed CEO Craig Comrie, who believes that health literacy and preventative care is the only long-term solution to help knock down healthcare costs for all South Africans.